It is just a huge honor today to bring in an industry legend for my entire career. Carey Lyons was born and raised in New York City, where he resides today. During his high school and college years, he was a yacht captain on Long Island, New York. Upon graduation from college, he went to work for the owner of his last yacht at Union Broach, a leading supplier of endodontic instruments, as a sales representative and regional sales manager on the East and West Coast. In 1979, he joined Weldent, now Colteen Weldent, as a global product manager for Parapost, the world's leading endodontic post system. In 1984, he founded and was president of Ben Air USA, the Swiss manufacturer of rotary drill and inventor of pneumatic-driven electric handpieces. In 91, Carey joined a small dental pharmaceutical company, Sultan Chemist, and became the executive vice president and led it for 18 years, expanding the business to 85 countries, 100 employees, and broadening the product portfolio with brands like Genie VPS, Topex, PureVac, Former Cresol, Sensitep, Comfort Mask, ProSonic, Turban Guard, and sold the company, Sultan Healthcare, to Dentsply in 2007. Did you sell it to John Miles? Was that the guy at the time?
No, he had retired already.
Okay.
Brett Wise.
In 2008, he joined Henry Schein as president of Global Exclusive Brands. Carey identified and acquired products to expand into new areas such as orthodontics, endodontics, implants, lasers, and CAD/CAM, and international markets such as the Middle East and Japan. In 2013, he founded and is the CEO of ids-integrated dental systems, a manufacturer and distributor of dental implants and accessories in partnership with dental supply dealers, and the provider of extensive education to train dentists on implant placement, restoration, and advanced surgical procedures. IDS has grown to almost 50 employees with 9 distributors over the last 6 years, with thousands of users across the United States. Hundreds of dentists have been trained annually by advanced implant educators and their co-directors, Dr. Scott Gantz, who I need to get on the show, and Dr. Isaac Tawal, who I have had on the show. Carey Lyons has been in the dental industry since 1976 after graduating from City University of New York Queens College. He posted a letter on Dental Town the other day that it was, do you care if I read it? Or is it okay if I read it?
No, that's fine, Howard. Fine.
Okay.
Yeah.
It says, "Dear Howard, you've done well with Stan Bergman and Jim Glidewell interviews, as well as posting truthful coronavirus data. I believe most dentists don't understand that most of the dental industry is made up of small and very small businesses. I estimate that 99% of dental manufacturers have less than $100 million in revenue, and 97% less than $20 million, and 85% or more less than $10 million. Our industry is made up of thousands of companies that have less than $10 million in annual revenue. I think dentists should and need to know this. If sales are suddenly down from 10 million to less than 1 million, you can only stay in business with dramatic overhead reduction. Of course, all sales and marketing expenses will be eliminated, but severe headcount reductions must be made by all companies, large and small, with such a severe and sudden reduction of sales. Small dental companies are like families with under 50 employees. We've grown up together, celebrated birthdays, weddings, graduations, and birth of our children. We suffer together through illness, downturns, and emergencies. The company is part of our soul, and we are a collection of hundreds of small dental companies, many multi-generations. This crisis is heartbreaking. The larger public companies, only about 10 USA and 4 international dental companies are public, can take a bit more time, but will have to reduce headcount. Small business will look for emergency bridge loans and business interruption insurance, but these are stopgaps and companies cannot absorb mid to long-term employee retention without revenue. Additionally, with debt being so expensive over the last years, many businesses are highly leveraged and will have limited choices. I think dentists should understand the companies that supply them $10 billion a year in the USA of products are innovating and investing in new technology and service are in as bad a place as dentists, if not worse. U.S. dentists are the best served consumer in the world. They can buy anything for their office from almost unlimited suppliers, have products delivered in a day, get unlimited credit from suppliers, have products and services brought to their office to be demonstrated and tried, return almost anything they buy for full credit, have repair service done the same day, get free CE online. I think they take the manufacturing distribution business for granted, which means we are servicing them very well, or underestimate the complexity and cost costs involved in providing them world-class service they receive. The return to normal business will be long and slow due to massive unemployment, lost dental insurance, personal debt, and patients deciding to spend on necessities and not elective dental procedures. We must look to work together and not be selfish, greedy, or take advantage of each other in these unprecedented times. We must find ways to be mutually successful in rebuilding our profession industry. Would love to hear your opinion. Man, what an unbelievably amazing letter. So, update. So the Congress decided that since we're $19 trillion in debt and have $58 trillion in unfunded liabilities, why not spend $2 trillion? They passed the $2 trillion bill last night. Have you seen it, and what are your thoughts on it?
Well, my thoughts are we've already applied for the SBA virus emergency funds, which is directly to the SBA to give us a bridge. Secondly,
well, what is that program
we've
called?
heard about this, but we'll see how do you get it, who's going to be offered to. We're very pleased that they're both extending unemployment benefits and also increasing the upper limits of unemployment benefits for higher incomes. More importantly, we're excited that there looks like there's going to be funding that if we retain our employees that we furloughed and pay them, that the government will back us up. It's what my friends in Europe and in Asia, what's happening with them. I spoke to a colleague in Brussels the other day, and Belgium is Holland. I'm sorry, not Belgium. Holland's paying all his employees for 90 days as of now. But at the end, we have a team. We have almost 50 people. We want to maintain it. We wanted to keep it together, and any help we could get, because I don't care how big or small the company is, when your customers, your consumers are told to not practice. And this is very important. It's something I 100% agree with. I live in New York City. I see that we were fast to get people to social distance. It's actually non-social distancing. You don't want to be social. And I think that it's starting to turn. We have a very dense city. We have the largest population of people from over almost 200 different origins in New York City. So, of course, we're going to be affected first. And our government, our local government, especially our governor, has done an amazing job of communicating what our needs are and what we need to do. And we're taking action. But we must not treat patients unless it's emergency. When I see the beaches in Clearwater, Florida packed, and I see the Cherry Blossom Festival packed with crowds, what's going to happen in those locations, and we could already see it post Mardi Gras, you're going to have waves of this virus spreading. The only way to stop this is to stop it. And, no matter, the life comes first, and we will get back together. And this is really why I wrote. I think your dentists fully understand they're under many pressures all the time. If it's DSOs or local regulatory, this overrides everything we've been through. And I really wanted, for someone that's been working with dentists and the dental associations and societies for 43 years now, it's not just my profession. It's my hobby. It's my life. It's my family. It's my joy. We need to stick together right now. We need to help each other through these times. And, we don't need to be adversarial. We need to be supportive. So again, we must stop. We cannot disregard the federal government and the ADA and almost every state association to do only emergency surgeries. Please. We must stop spending now. The businesses, the dental offices, we need to save ourselves. Excuse me. We need to save our practices, our companies, and be able to come back We can't just walk away. So we have to take drastic action. I'm quoting someone, paraphrasing them, that I saw last week. Our heart takes us very far, and we can't allow our hearts to take us further, that it actually self-destruct. So our head has to take over from where our heart takes us. And, my point in writing to you the other day and speaking today, understand we have thousands of companies that employ tens of thousands or hundreds of thousands of people. I think we all know 3M, but really it's a handful of companies in the whole world that are that large. And, we're made up of families, of single companies. Many, many, many have been multi-generational. The grandchildren, great-grandchildren of the founders. If you look at companies like L&R Ultrasonics or Benco Dental Supply, and we can look through all of the people, all the products in your offices. You have to understand we're in the same boat. So how do we work together when we're starting to rebound? Because depending upon where you live or what you think, there's going to be a period of time where we're almost zero. And then there's going to be a period of time of recovery. And that recovery is going to be, to me, my forecast, it's going to be a slow drip. People are going to be in debt. People are going to be unemployed or returning to employment. People are going to have lost their dental insurance. And I'm usually, anybody that knows me, I'm one of the most optimistic people I know or have ever known. And the reality here is I'm going to pay my mortgage, I'm going to make my car payment, I'm going to take care of my family, and elective dental procedures. My products are used, 99% are elective. It's going to take time. It's going to take months after people start going back to say, okay, I now am going to spend money on elective dental procedures. So we have to be realistic and not overly optimistic. So remember, 99% of the manufacturing distribution community that services this $9-10 billion market a year, which is a cottage industry. Johnson & Johnson has probably sold more Band-Aids during our conversation than all the dental products in the world, get sold, this today. So it's interesting because I don't think we are, the dentist, the profession doesn't think about us that much. And you know what? I think we do a great job. I think dentists are one of the best, if not the best served consumer in the whole world. I mean, if you went to your car dealer and said, I drove the car for 3 months and, you could take it back now. And they said, okay, no problem. You'd be surprised. Dentists are really well serviced and happily, and they're providing great services. They, no matter what to talk about DSOs and the changes in our profession, I don't know what the numbers are, but it's probably 70-80% are still single or dual practitioner practices. We're still a relative cottage industry, and we will remain so because it's a very personal relationship. One of the main points I really wanted to discuss is our industry and our profession has been what I would call recession-proof or recession-resistant. In this, when I look at post 9/11, I look at post 2008 financial meltdown, we came back. But we didn't lose that much, right? So you didn't do the new crown or you didn't do the full mouth rehab, but you still did your fillings, you still did your hygiene appointment, and they were still billing. So, we never had a double-digit decline in dentistry. We barely had a more than a low single-digit decline through those months post, a drama. This is going to be very different. Not only will we have a very severe, 70, 80, 90, whatever you forecast decline over the short term. It's going to be a longer term decline. And that coming back is going to be longer term too. It's a very personal service. You can't social distance from your dentist and hygienist and dental assistant as a patient. Although I did see something on YouTube yesterday where they had someone isolated in a box and they were putting their hands through, but that's a whole nother story. So it comes down to what do we do? How do we work together? I could, as a manufacturer and a supplier to the profession, we'll lower prices, we'll extend payment terms, we'll help people get through that have financial problems. We'll work through our organizations, the American Dental Association, state associations, the Dental Trade Alliance, which is the largest group of dental manufacturers and distributors. It's our industry trade association. We need to talk, do we need 100 different dental shows next year or the next 2 years? Can we afford shows that last 4 or 5 days and cost hundreds of thousands of dollars? Does the profession want to come to live shows like that? When they're struggling to get back after this. These are questions we have to sit down. We can't be self-minded. We can't be greedy. We can't be greedy about any individual enterprise or organization. The only way to really do well is to do well together. And that's what I really want to reach out to you. I want to hire back all my furloughed employees. I want to expand my business. I want to do well. I want to help our existing customers and new customers. There's going to be different opportunities, but I think coming out of this, we're going to have a different world. And we're certainly going to have a different dental world. Because if you look, there's nowhere at this time where there's a market that's buying products and using products. The big Asian markets, Japan, China, Korea, they're not operating at anywhere near where they were. All of Europe is shut down. Italy, Germany, Holland, Belgium, France. These were huge markets, combined much bigger than America, but there's zero. You can't even go into the street. So what's going to happen there? And India, as of today, the entire country, the second largest country in the world, closed. You can't go out. So we have to take this into account, and we have to figure out methods, systems, and ways to work together between the industry and the profession to help providers, to help patients. We've donated, as you introduced me to the Brighter Way years ago, a nonprofit foundation in Phoenix that provides free dental care to homeless and predominantly homeless veterans based in Phoenix, Arizona. We've donated millions of dollars of products over the last years to give veterans teeth, to let veterans go out and feel better by themselves. So, our industry gives back. We're small. We're not a huge industry. We only have a few handful of companies that are public. We need to find ways. And if I don't have the answers, but I'm willing to help through our associations, through Dental Town. You start to think about everyone. Our business is a microcosm. So as a manufacturer, we're making less, we're employing less. But then there's dental publishers, all the magazines you get every month. I don't think people are going to be spending a lot of money on advertising if there's no business. You're not going to be printing literature. Your research and development, which in dentistry is so vital and so expensive. And when people say, oh, products are expensive, the cost of research and development and regulatory approvals are huge. They're the same for a dental company as they are for a medical company or medical device companies in a market that's a microcosm of those markets. So we need to work together to provide products to get the profession back on their feet. The only way the industry comes back is when the profession comes back. And that's when patients come to you to do treatments. And we can make them, if we have to, lower cost, extended pay, whatever it takes. And again, I don't have the answers. I'm running a small business with 46 employees. I'm spending last year $9 million. Okay, that's in wages and in buying goods and services and manufacturing and paying for products. So that's my whole story. I mean, I want to do well. I want us to work together. We need to take care of ourselves and our companies and our families. The health comes first. If we're not healthy and we're still spreading the virus, does no one good. But let's plan on what to do when we come back. Some things we've thought of is, learn more treatments, more procedures, more therapies you can provide to your patients, maybe that you haven't done in the past. Keep your patients in your office. Maybe it's sleep apnea treatment. It's facial fillers. It's minor orthodontics. Maybe these are things you never did before, but maybe now you take the time online to learn more and adopt them and offer those to your patients. There's a huge amount of your active patients that probably you could provide services to that you haven't. And your volume's going to be down. So let's work together. Let's figure out a methodology, how to execute that togetherness, how to lower cost, how to invest in new technologies, and how to sit down with your supplier. I had a dentist. He had a long-time representative, helped him when he came out of school, designed his office, built his practice. He grew it to about $6 million a year in a dental practice in a middle to lower middle class suburb of New York. Howard, and I'm sure you could tell your audience, $6 million is a substantial practice for a single operator. Obviously has many dentists working for him. He's multidisciplinary in the practice. His representative that was with him from graduation, that worked for a small local dental supply company that was eventually acquired and retired some years ago. He called me, "What should I do, Carey?" I said, "Is there a representative you like that's now been trying to work with me?" He said, "Yes." I said, "Call him, Stephen. Call him and you invite him to lunch and sit him down." And I said, "Stephen, before I say anything else, make sure you buy lunch, because you never buy lunch for anyone that supplies you products. And that's going to go a long way. And you tell that sales rep, look, I really like you. My whole practice, we buy a lot of product here, hundreds of thousands of dollars or maybe $1 million. But more importantly, it's 6% of my practice revenue is spent on supplies. I don't want to shop. I don't want to haggle. I don't want the day my vacuum goes down to be out of business in my chairs. If you will give me what I need and maintain my overhead percentage, I'll give you 100% of your practice, and I'm not going to worry about where am I going to go buy a cheaper masks. Well, that probably bad example, because they're not going to be cheaper anymore. But cheaper gauze or anything less expensive, because that's really the only thing I have that I can control. Outside of my lab and my supplies, it's my office, my employees, my rent. This. You talk about this all the time. So I'm spending 50% of my time trying to control 6% of my expenses. Find the right person that will work with you, that will be loyal back to him, commit to them, and they'll be able to help you through this time. My company, my representatives, my distributors, we'll be able to help you.
So, Carey,
that's my message.
This SARS outbreak. I mean, I know the disease is COVID-19, and a lot of people are calling it the coronavirus, but it has no official name, and it's severe acute respiratory syndrome 2. SARS. We this is. I mean, we had a breakout with that 17 years ago.
Yeah.
And so now it's back, and so it's gonna be back, and it's gonna mutate. How will this change dentistry in the long run? Because in 1984, you were the president of Bien Air USA, the Swiss manufacturer of rotary drill and inventor of pneumatic-driven electric handpieces. Do you think everyone's known their whole life that when you walk in a dental office, it just has that smell? Because that high speed is like a little jet engine that's perfect for making aerosols, and you can smell that office in the wall and the ceiling. I mean, it just has that smell. Do you think that this may be the final nail in the coffin for the high-speed handpiece, pneumatic drills, cavitrons, hygienes? Do you think we're going to have to find a non-aerosol producing way of removing decay in the future?
Yes and no. I let a couple of things. That's a good point, Howard. Actually, at that time, when I started to run a handpiece company, was the time when Dr. Acer was exposed for injecting his patients with HIV/AIDS. And the world changed for dentistry, right? Remember?
Yeah, well, yeah, absolutely.
I can't recall. I think it was like late 80s, if I remember correctly. Dentists didn't wear gloves and masks regularly. Dentists didn't all have sterilizers. It's not that long ago. So I can tell you what a friend said to me the other day. He said, I was laid off of my job, and I had some time, and I went for a cleaning. I said, why would you go to the dentist? Well, because the dentists, they've been so well protected for so long now. So I think the public understands that dentists practice better one-on-one infection prevention than most practitioners do. So that was an interesting comment. I think, but you're correct. We will evolve. I mean, there's a whole generation of dental lasers coming that will alleviate the use of high-speed drills, and other aerosol devices. Will it go to zero? No. But I think certainly the public, and more importantly, the profession, will be much more open to learning how to use these new devices. But dentistry has a great safety record since the late 80s. We've invested more as a practice in the profession to have sterilized single-use items, sterilized items, medical devices like our dental implants that are sterile when they're delivered. We're very, very efficient with, they never touch, my dental implants never touch anything but titanium until they touch the tooth for replacement. So, dentistry's been revered and in many cases criticized for overreacting. And I think if there's one philosophy I've heard from, what's his name, Anthony Fauci, who to me is the all-star on that panel, it's like, if you think you're overreacting, you're probably not doing enough. I would rather overreact and live to fight another day than underreact and die. And I mean, die not so much in the sense of physical, but my business, my practice, my relationships. Overreact now, doing everything you can, and then if it is an overreaction because the springtime comes and the virus goes away, you can bring everybody back and send out letters and have everyone come back to their office. But if it takes longer, be prepared. That's my personal advice to my colleagues in the profession and in the industry.
So, Carey, you're in the largest city in the United States of America, New York City. What percent of the dental offices do you think have stopped doing routine dentistry and are only truly seeing emergencies as of today, right now?
I don't know of any offices open. I haven't heard of any. Patients are not going. I think as of this week, it's over. I read something very disturbing today on Facebook. I don't remember where it was, but the dentist had a patient that had provisional veneers, like 8 or 10 of them, and closed their office because they were following the recommendation. And then the patient called and wanted a refund for the work they had done because they found a dentist that, yesterday that did the work, which is fully elective. And, the morality and the ethics and the karma of that is just horrible. So, look, I'm sure there's dentists that are working. I'm sure there's some activity. But I could tell you that patients don't want to be at the dentist. They're not going to the dentist. The staff, there's a worker safety issue here, right? Does your staff want to be with patients coming in? You don't know where they are. There's a proximity, a closeness that's really threatening. As an employer, do you want to have the potential liability of your staff being infected or your patients being infected? There's such a high prevalence now of people that are asymptomatic. So you don't know. I mean, it's like the kids in Clearwater on spring break. This morning, I'm looking at Louisiana due to Mardi Gras. It has this huge incidence of people with the virus because they were in such close proximity. We don't know yet. There's so many unknowns here. If India said 1.2 billion people stay home, I mean, it's the only thing we could do right now until we find drugs and then eventually find, vaccines. There's nothing else we could do.
Your point with David Acer, I think it's pronounced Acker, David Acker,
Okay.
who died in 1990. He was the American dentist who was accused of infecting 6 of his patients with HIV. According to Wikipedia, they never. The Centers for Disease Control did say that it was absolutely possible. So when they looked at the evidence, it could have been. But you're absolutely right. That event changed dentistry forever. When I can tell you stories that you wouldn't even believe. Like when I got to Arizona, my favorite, most fun dentist to hang out with was a 70-year-old guy, and he uses Cuspidor as an ashtray. I mean, he had like hundreds of cigarettes, and now we don't even have Cuspidors.
Howard, just on that note, I remember it must have been 76 or 1977. There's a building in Manhattan called 57 West 57th Street. It's like 20 floors of just dental offices. It's been there, forever. And I used to, you have to buzz to get in the building, buzz to get into the office. And I remember, visiting dentists. They were having lunch, smoking cigarettes, and while they're doing dental treatment, no masks, no gloves, at lunchtime doing nitrous oxide. It was crazy, that when you think about what dentistry was like then, and how much this profession has both invested and earned the credibility of being a safe place to go. So it's real. And I think you forgot about Acer, and that was way more dramatic than the 9/11, 08 financial, or SARS. I mean, the SARS outbreak, I manufactured masks in those days for Sultan, my company then, comfort face masks. And we were, just like now, we were making them, but they're nowhere near what's happening today where, everyone in the public wants the masks, not just at the dental offices. It's a whole new proportion. So it's, again, unprecedented is a word you hear every day now, but it truly is. Wouldn't you agree?
Absolutely. And what's interesting is that the universal precautions that came out in it was introduced in 1985. In
Yep.
'87, everybody agreed from this scientifically, but it took David Acker and it took Kimberly Bergalis going public with her
Right.
story
Right.
to make a major change. What other? So I'm going to switch gears completely because where I'm
Okay.
getting the most emails is, this is March 25th. And we are just a month of May away from 6,500 new doctors of dentistry entering the U.S. workforce when demand is contracting because of SARS-2. They got $400,000 of student loans. They might think this is the worst time to graduate, and I believe they couldn't be more wrong because I've lived through 5 economic downturns. I graduated from high school in 1980. That was the worst, that 21% interest rates, double-digit unemployment.
Yep.
And then I graduated from dental school May 11, 87, and 1987 stock market Black Monday crashed. And then I lived through 2000, the Y2K, the Lehman's 2008, and this is 2020. I always thought when I was growing up that all of my friends, dads and grandpas who grew up during the Great Depression, they thought totally differently their entire life. They always knew this was that what goes up can come down. Do you think Jack Welch used to always say that the best way to become a business leader is a near-death experience. So
Right.
I think coming out in 2020, the class of COVID-19 2020, 6,500 dentists, by the way, welcome to dentistry. We need you to replace us dearly. And I think they're going to come out and they're not going to be like the graduates who come out of dental school from 94 to 2000 when anybody could buy a stock and it would just go up higher and higher. And then when it crashed, I couldn't believe all of my personal friends that had invested tons of money and got leverage in real estate development and condominium development and were buying stocks on margin. And here's these amazing endodontists with $1 million practices going bankrupt because of this. So I think it's going to make them a depression-era kid in wiseness. But what advice would you have for the class of 2000? And by the way, Jack Dillenberg is texting me saying, hello. Jack wants me to tell you hello.
Well, before I answer your question, I've been thinking about Jack Dillenberg because not only is he a wonderful person and one of the smartest guys I've ever met in public health for dentistry, his opinion now and his leadership would be invaluable because exactly dentists that came out of school because dentistry was a press to make money to do $50,000 cases. Jack Dillenberg was the first one to say, no, I'm going to open up a school in Arizona, a little bit north of you, and we're going to teach people how to give back to the community and how to provide dental public health service and really learn and understand. And if there was anyone that has a real ground level view of this, it would be Jack Dillenberg. To answer your question is, I believe that what's one of the things that's going to happen now is the private equity money that came into dental service organizations are going to decide, do I really want to be here? Well, certainly we're going to stop growing and investing, and we're going to decide what we're going to do going forward. Dentistry is still a very local and a very personal business. When you got out of school, you hung a shingle. You probably a little smarter than most, looked to see where is the best place to open a practice, hung a shingle, and started doing dentistry. But you don't need 200,000 customers to be okay. And I think that they need to come into these markets, if it's opening their own practice or working in existing practices or in DSO practices. And that their ability to earn very high incomes very fast, they're going to understand coming in is not going to be there. And they're going to have to find their path, and they're going to have to give back. They're going to have to do some pro bono work. They're going to have to really lower their expectations over the first few years. But there's still going to be need. There's going to be a huge public health need. Hopefully, our government, which today or last night, this $2 trillion bill looks like they're going to help us in many different ways. Hopefully, it's going to be well directed. And if it's dentistry, dentistry is included in future Medicare, Medicaid. If people that can't afford dentistry will get it, and the profession will get reimbursed. I mean, you understand the connection between oral health and overall health, how important that is. Isn't your local congressman a dentist, actually?
Yes, yes.
Yeah.
And I went to Creighton with him. I was on the 9th floor, and Paul Gosar, a dentist from Flagstaff, was on the 8th floor. I think he was the RA. And but yeah, I've known him since 1980. In fact, when I got mugged, I'll never forget it. My favorite Paul Gosar stories. I got mugged at Creighton because at 1 o'clock in the morning, I decided to walk down to McDonald's before it closed, and it was but anyway, and when I came in all bruised up, I mean oh my God, he flew out the door. He ran down there and tried to catch him so hard. He's a fearless guy. But there's 5 dentists in the Congress right now. Is it 5 or 6?
I don't know, but maybe you should talk to him, have him on, and say, what are we going to do for the public health and for dentistry? So,
yeah.
But I look, it's not going to be easy for anyone now. It's not going to be easy for anyone. If you had a million dollar practice, I forgot what is the average practice in the United States today. The average dental income is about $180,000.
Yes.
I don't know. So what is it, about a $600,000, $800,000 practice?
Yeah.
So, and you had 10 or 15 staff member. I mean, it's all going to be downsized for immediately, and then for some time. The question is, none of us know is how long, how slow to get back to what we would consider some semblance of normal, or 2019. I had a fantastic year. In 2017, 18, 19, my dental implant business was growing over 30% a year. And, now I would expect over the next months, we're going to have a 90 or more % drop. How do you go from millions of dollars a month to zero or close to zero?
Yeah, so we have, there's 4 congressmen. There's Representative Paul A. Gosar, DDS, Mike Simpson, DMD, Dr. Drew Ferguson, the 4th DMD, and Dr. Brian Babin, DDS. Have you heard what their thoughts are for dentistry?
No, but my thought's been that we need Medicare, Medicaid expansion, for dentistry.
So,
and we need rates that a dentist can afford to provide care to those patients. We have a national Medicare, Medicaid problem.
So are you thinking universal health care, like what Bernie Sanders was talking, or what are Medicare for all? I mean, we already have. I mean, every American loves their Medicare over 65. I don't know of anyone that doesn't like it that's over 65 in my office. Are you recommending that for everyone, and it covers dentistry?
I am not an economist, but from a public health standpoint, not to include dentistry and not to include medical and dentistry for everyone. I don't know if it's Medicare for all, but I don't know why any American should not have medical coverage. If it's with third party, single payer, to me, that's politics. We're doing the right thing now by taking $2 trillion we don't have to prop up our economy. But go in the future, to leave dentistry aside, go downtown, go to Bright Away, see what those people's lives are like without teeth, with malnutrition because of the pain they're in, because of their lack of dental care, and see what happens when they get teeth. They could actually get a job. They could actually get a relationship. It's life-changing. And it's not just cosmetic. Cosmetic will come back. We'll be okay.
So you have not heard from any of these four dentists about the
No.
$2 trillion bill passed.
And I haven't heard anything about any of the bills, about anything relative to dentistry either.
One of the terms I cannot stand is when people say the United States of America, because no one talks about Europe like that. They never say, well, Europe does this or that. They pull out the difference between Germany and France and the United Kingdom and all that stuff. And I mean the United States is a vast country of 331 million people. There's 200,000 Americans alive today that have an active license to practice dentistry. About 150,000 general dentists, 30,000 specialists. But there's a lot of patches of dentists that are still going to work today. And sometimes what makes them see straighter is if they're going to get sued. Do you think a dentist seeing patients today could have liability? I mean, look at the Vancouver Dental Convention versus Hinman. Hinman now looks like a genius. And
Right.
The Vancouver Dental Association looks like the last of the before everybody got religious on coronavirus. So, do you think the dentist?
Oh, they held the Vancouver exhibition.
Yeah, they had that convention, and there's an outbreak. I think 4 people have been confirmed. And there's one dentist is now dead.
Well, Atlanta Hinman meeting's been canceled.
Right.
The California Dental in Anaheim has been canceled.
So those guys look like geniuses. But do you think the dentists practicing today are getting kind of like British Columbia, Vancouver, where you're out of the safety zone? Do you think that 3 months from now, when epidemiologists say, hey, these 4 patients all had COVID-19 and they all saw you the week before they were hospitalized, do you think that's a real concern?
Yes. I think it was yesterday the governor of Mississippi, who is surrounded by Louisiana and New Orleans on one side, and Alabama, Birmingham, who has don't leave your house on the other side, basically said things are fine in Mississippi. Yeah, we don't have any problems. So it's the states of America, maybe not united. And
it's a continent. I mean, we live on a continent. It's I mean, how do you compare Alaska to San Francisco? I mean, this is a huge.
But
country.
Howard, but we must today overreact. Just last week I spoke to my representative in Houston. He goes, things down here are pretty good. We got guns. We don't, we're still going out. And I'm like, are you serious? Like, now obviously the Texas governor has closed all the restaurants, and because this is the only weapon we have right now. If we don't do this, it's just going to be a longer tail, a longer recovery, and devastating to our life and our economy. So, and you know what? A lot of us are spoiled. Every year I'd spend hundreds of thousands of dollars to go to a dental shows or to exhibit. But I have people that build my booth. I have people that do my printing and my artwork. We would go to Hinman. It would be $75,000, $100,000. And now people, over the last 5 years, the population, the attendance at these shows have been people over 50. The young dentists aren't coming. They're not taking time off. The Greater New York Dental Meeting, for years, historically, it was wonderful. It was in Manhattan right after Thanksgiving. You'd come, stay in town. those days are over. The Greater New York meeting, no one comes, or they just come, no one's buying. We have 365 sales, marketing, online, people coming to your office. You could try anything, do anything. Do you really need to go to the exhibition floor? Do I really need to spend, or we as an industry need to spend tens or hundreds of millions of dollars to bring these elaborate booths in? I'd much rather lower my prices and give the profession terms or free products to treat people that can't afford it. We have to come into some type of balance now, and that's why my call to work together with the associations, and obviously a show, the Georgia Dental Association. I'm sure one of their single biggest revenue producer for the year is the Hinman meeting. But, things are going to change, and things have to change. The companies are not going to go back. And if you see now, we've had a very consolidated industry, right? When I used to go to the New York Hilton Dental Show, they would line up on Sunday morning waiting for those doors to open to come in with their lists. Now, people don't go to shows much anymore. It's a waste of time. What am I going to see? Maybe if I want to try sit in a new chair or something, but there's really no desire. So I think this awakening and this trauma is going to make us all think, what's the definition of insane when you keep on doing the same thing over and over again that's not working? I think we can either individually come to that, or we can work together to say, what are we going to do? Maybe we do one-day educational events with some displays, but it's only a table. Okay, and and if you come, you get these dramatic discounts to use product. I don't know what it is, but we need a think tank. We need a methodology to execute, and we need to help each other because this is unlike any of the other things we've mentioned in the past. It's going to affect us in ways.
So have you read the new bill, the S-3548? It's to provide emergency assistance and healthcare response for individual families and businesses affected by the pandemic. You probably haven't had time to read that.
No, I haven't.
So right now, Carey, I have they're young. You've been a leader in this industry forever. How do we pay employees considering the recent legislation? Do I need to lay off my employees, or can I stop paying them? What do I do with staff members that say they are afraid to work? What are the rights as furloughed or laid off employees? How would you wrap that up? And it's hard for you to answer because, again, the United States of America is 50 states that are very strong, and the federal government is an overlay. So you have federal laws like Medicare, you have state laws like Medicaid. I'm talking to my international audience. So you can't think of the United States as like Australia or Korea, where South Korea did this. The United States, the Fed may say we're all blue, and half the states may say, well,
Howard, I think I could give you a pretty informed answer to that question because, I'm the past president of the Dental Trade Alliance. I've been active in the dental trade and the industry for decades. I was on the board of directors for more than 10 years of the trade association. And I've been talking to a lot of friends that have medium-sized businesses. Look, the definition by our government for small businesses are businesses under 500 employees. There's very few dental companies that have 500 or more employees. So we're all in the same boat, and the dentist and the industry. So let me start here. If your revenue is $150,000 a month, or $1.5 million a month, which was more or less what mine was, and your income and your revenue goes from $150,000 a month in your practice to $10,000 a month, Decisions are, pretty easy to make because it's not a slow drip. It happened in weeks, in days. Okay, so you have to go find whatever assistance that's being offered. We immediately last Friday they posted the applications for direct SBA, Small Business Association, federal loans for emergency relief for small businesses. We applied for that. With this new bill, there's going to be other opportunities, for bridge. And one of the most exciting things for me is that you could retain all your employees with this package that was passed last night and pay them, and the government's going to back us up. But at the end of the day, if you don't have that, or if that runs out, if it doesn't recover, you have to survive. You have to furlough, and that's what we did first. We furloughed people because that retained their medical benefits, and that's a human thing to do if you can. And otherwise, you don't really have a choice. If your staff was supporting $150,000 a month practice, and you're now doing $10,000 a month, what would you do? What could you do? You're going to try to hold on for as long as you can. And, my heart took me very far, but my head had to take over and say, for me to be able to be viable, to be able to bring all my employees back from furlough and bring more employees on, I have to survive. I have to work through this. And I don't think it's different for a small business. I don't think it's different for a big business. I mean, the largest companies in our industry and in all industries, they're having these meetings every day now. If you were doing $100 million a month or $50 million a month, and now you're doing 90% less, what do you do? I mean, you just need some time to be able to figure it all out, and human resource issues, and it's going to take you a little longer. But the other thing I'm surprised you haven't mentioned, because you're kind of like the dental economist. Debt has been so cheap for the last years. So many people borrow because it costs you nothing to borrow. And now what's going to happen to all those trillions of dollars of debt that all the companies, all the professionals, all the practices have? There's going to be a huge debt problem behind this. So the reality is we all have to live and survive to live another day, to be viable, and find partners, find ways to help, find ways to cooperate, find ways to alleviate strains, financial strains for our staff and for our patients. But they're all going to be tough decisions. Don't be greedy. Use your heart, but don't allow it to destroy yourself, your family, and your business and your practice.
Well, under ethics, the things that pop up in my mind for ethics is, what are ramifications of staying open and treating patients that may or may not be deemed emergencies? If a patient calls me after a visit where they felt fine to say they are now sick, do I need to notify my patients that they were seen, my other patients that they were seen that day? Are we obligated to shut down when the recommendations have only come from organizations?
I would say yes.
Like the ADA?
And your staff?
Liability for transmission, staff to patients.
Yep. And patient to staff. Liability all over. But, legally, but I would think legally, but ethically.
Yeah.
I mean, it's just, I'm sorry. I wanted to cry for this dentist that posted that some guy in his community placed those 8 veneers, and then the patient called him for the refund for the prep. I mean, unbelievable. You can't, I'm sorry. And you know what? 43 years. Dentists give back. Dentists are ethical. When you see, missions of mercy and give kids a smile And everything we do, because we don't have the government supporting us to any great degree, or supporting our underprivileged or our poor. Dentistry has been amazing on what they've given back to provide free dental care out of their own pocket. There's a book, it's called Teeth. Do you know this woman, about how dramatic the lack of oral care on our underserved population is for their total health, and it's unbelievable. Read it. I can't remember it.
It's a great book.
You know what I'm talking about.
Yeah.
I can't remember the author's name,
yeah.
But have everyone read that. Look, I'm a capitalist. I've been very fortunate for decades. I've been employed. I've grown companies. I've taken companies like our company now. We had 11 employees, and now we're almost 50. At Sultan, we were a handful of people. We went to hundreds. At Whale-Dent in the 70s and 80s, we had many hundreds of people in manufacturing. It's a great industry. It's a great profession. We need to work together, but we have to be realistic at this time.
And do you think they are being realistic at this time?
I don't know. I think people will get there. I just see it in my own organization. It sets into the severity and the depth, and what I call this is the negative trickle down economics. When no one's going to the dentist, I'm not advertising, I'm not going to the show, I'm not traveling, it affects in our small cottage industry so much.
This is truly unprecedented times. We were historically, dentistry and the dental industry has been recession-proof or resistance. This is different. All stakeholders will be forced to reduce expenses with loss of revenue, possibly 100% for some time, and our recovery will be slow. It reminds me of my favorite dentist economist, Marco Vitocek. After the last Lehman Brothers day collapse, when it came back, he noticed, he wrote an article that dentistry, lawyers, and lattes, that dentistry, the dental profession, lawyers, and lattes were lagging the comeback, really showing that it was more discretionary in general. Right. How long do you think this shock is going to be? How many quarters do you think this will be? And then how long do you think it will take for dentistry to get back to where it was 2019?
Okay, well, this is one man's opinion, and believe me, I have no information more than anyone else does. I see a devastating second quarter of the year. April, May, June, I don't see much change from today. If anything, it's just going to be in waves. New York is going to flatten out, but there's still going to be extreme cases. And then it's going to go to other cities and other states, and we're going to have waves. So my guesstimate, it will begin to get better in July, August, or September. And then it will be at least 6 months of a drip back to people being confident in their health, in their employment, I'm now going to go spend money on elective procedures. Like, okay, I feel my job is now safe. My portfolio's back a little bit. Okay, I'll go get that crown done. But, so, I don't have I'm not optimistic. I think I'm being realistic to say it's going to take, from whenever people do start thinking about going back and some semblance of normalcy, I think it's going to be a minimum of another 6 to 9 months after that. Of course, if we find a drug now that cures it, or the vaccine comes up, or hot weather eliminate, these things will accelerate it. But I think from where I'm sitting today, can anyone say in July people are going to start going back to the dentist the same way they did in 2019? Yeah, show me why or how. I just don't see it, and I don't want to be a pessimist. But I think my advice for dental offices, the profession that supports dentists, the industry, I think we have to prepare for the worst, and if it gets better faster, we'll be okay.
Well, let me read Jack, because you and I have we're both members of the We Love the Happy Dean, Jack Dillenberg, who's really always been a legend. He sent me this today. He says the COVID-19 pandemic, an opportunity for you to make a difference. As I sit here in Jerome, Arizona, I am trying to focus on not catching the disease while doing what I can as a public health provider and a community leader. I realize that this is a generational moment that could not have been imagined or predicted. Here in Jerome, a town of 457 people that is one of the most popular tourist attractions in Arizona, is being called upon to thrive while shops, galleries, restaurants, bars, and wine tasting rooms are closed and jobs are evaporating. I marvel at the generosity of a local restaurateur that opened their doors to distribute all of their food for free to local citizens. How other healthy citizens are preparing food for those that are unable to leave their homes while the town shuttle is being donated to bring food from nearby markets. Those of us in the dental field are asked to not provide elective dental services, which has a significant financial impact on our practices and clinics. I wish that organized dentistry would work with our healthcare professionals to see how dental personnel, dentists, hygienists, therapists, community health workers, and assistants can be integrated into the overall health medical environment. We need to work with the health insurers, payers to develop reimbursable ways that telehealth can be effective means to provide needed services to our patients without them coming to our office clinics. We need to adopt reimbursement opportunities, allow those with special needs, those with autism, Down syndrome, and other conditions to receive elective dental care during this time that is draining our healthcare resources. I've had to make some significant adjustments to my calendar and travel plans. The Senior Dental Leaders Program in London, I was a speaker, was postponed 1 year, just 4 days before. Him and his wife Jamie were headed to England. Other speaking meeting engagements in Phoenix, Philadelphia, Charlotte, Nantucket, Israel were all postponed for up to a year. While an inconvenience, these changes are not nearly as impactful as the significant effect the pandemic is having on so many. Unfortunately, the strain on our health system and each other will get worse before it gets better, but it will get better. Please work together as leaders, though they may not be your personal aspiration, to engage our colleagues, elected officials, and payers so that we can be part of the solution in creating meaningful, responsive care, healthcare system that adequately pays our providers while not overcharging our patients for the care they need. Please be safe. Iowa,
Wow.
Delta Dental of Iowa, they reached deep in their pockets and they released $10 million yesterday for relief for their dentists, because they said,
Right.
man, we're all in this together. I mean, what's Delta
Right.
Dental without dentists? But I want to go back to the 4,000-pound gorilla in the room. A lot of countries have the Medicare for all, which we call over here socialized medicine. And America has socialized medicine for Medicare if you're over 65. Do you think this is going to be a major change for Medicare? I mean, do you think it's going to change dental insurance? Is that going to be, we started the show, what are the major impacts that this is going to have on dentistry? Do you think that's going to be one of them?
I think it has to be. Will it be successful? Will it change anything? I don't know with the state of politics today and division. But I do know we were underprepared for this. And from a supply chain, from an emergency preparation, from a call to action, immediacy, it's just in so many ways we've stumbled. We have so much, yet we had so little when we needed it. And even to catch up, you know, our governor in New York State, Mr. Cuomo, today said that the federal government is sending him 400 ventilators. He needs 30,000, and they sent him 400. I think yesterday. So today they're sending him 4,000 or something. But the numbers are staggering. The lack of preparation, of leadership, of guidance, of the immediacy that we needed. The only thing that some countries did well, because they're much smaller or they're much more able to control their population because of their politics and culture, was testing. They tested fast. They took fast action. Where we went on spring break and Mardi Gras. Live free or die. It's Howard. I know we'll be a better country if we take care of each other, if we take care of those that can't take care of themselves, that can't afford care. If it's a single payer, like was first proposed, I'm sure even before, but in the early 90s by President Clinton's wife, Hillary Clinton, as the head of that. If it's the Affordable Care Act, where we work with insurance companies, if it's Medicare for all, you can call it whatever you want. Americans should have access to reasonable Medicare, reasonable health care, and dental care.
But Carey, what I've loved about you is you're always so frank. And I remember one time when my little boys met you when they was little, it was actually Ryan. My boys are Eric, Greg, Ryan's at 30, 20, but he was a little boy. And he said, is everybody from New York City that intense and direct? Because you just tell like it. I say he's a smart man. So my question to you is, you've done business.
Howard, you're not from New York. You're pretty intense too.
Yeah. So you've done business around the world your whole life. Why is a national insurance plan so emotional? Why in the United States? Why is it such an emotional? When you talk about the fact that America spends so much more money on healthcare, I mean, we see. But why? Why is it so emotional? I mean, you can call me a.
I'll put on the make believe I'm on one of those talk shows on Fox News or something. I think people have used it to take a political decision. It's us against them, divide and conquer. Socialism, it's a bad word, and if you're a socialist, you're not going to get elected. But we have a lot of social programs in America now that work well. Look, you can label it whatever you want for your own purposes, but if you provide care to the population, I think that's a good thing. And if you're going to be able to sit down and work on it and not demify the other side for wanting to do that, they want to take your health care away. I've heard that many times. You know what? If you take what I have away and give me something as good or better, not so bad. But certainly if we give everybody something, even better. And in our little cottage industry that sells $10 billion a year, that's it. That's the whole industry in America. If we can find a way to sit down and put our personal desires aside to work for a greater good, that's what we need to do now. Let's try to fix it, and let's try to go to the Congress and the Senate and the White House and say we need dental care. I mean, I know our president's dentist. He's an advocate for good dental care. He's a great dentist.
Who's the president's dentist?
I don't want to share.
Okay, just text it to me, then I'll.
I don't know if it's public or not. So.
I'm assuming it's Larry Rosenthal.
No, it's not. But anyway, it's not important.
Okay,
I'm just saying he's got a great practice. His son is practicing with him now. His son's a great young dentist, and it's, and he's taking care of that family for many years, like all dentists. Just happens to be in New York City. So,
So Carey, with these 6,500 dental students, they're going to graduate a May away, and so right now, everybody's trying to figure out if this new bill is it going to delay their student loan payments and interest for 6 months, et cetera, et cetera. But when I got out of school in '87, the only people that would give me a job or my homies a job was the Army, Navy, Air Force, Marines, Public Health, Indian Public Health Service.
yeah.
Right now, the person carrying that burden is DSOs. And I do you think, what percent of the DSOs do you think will not survive this crisis of credit, who aren't cash flowing, that had easy, cheap money, which is now gone? Do
Yeah.
you see a contraction in the DSO market?
Well, I have been, and again, I have no data. I've seen the data that gets published. I think there's certain DSOs that are well run and more specialty oriented. They're limited in the services they provide. They're doing well, and they have seemed to done well. But generally, I think the takeover of the profession by DSOs has been dramatically exaggerated. I think they're doing well. But it's still, if I'm a dentist, I come out of school, and I know you quote a very large debt number, for graduates. I don't know if that's an average or is that, but I see a lot of dentists coming from families that are pretty well off, or at least middle class.
Okay, well let's address that right there. So the American,
okay, go ahead.
The American Dental Education Association always puts out the number that the average debt per graduating dental school senior in 2017 was $287,331. But that's intentional misleading when that 20% of the kids are like what you said, daddy and mommy pay for it all, they're already a dentist. So if 20% of the kids have zero debt and the other remaining 80% have 287, and they're borrowing $100,000 a year to go to school, and they're coming out $400,000 student loans, and the average practice to buy is about $750. So we're a May away from 6,500 kids coming out of school, where 4 out of 5 are going to have $400,000 in debt, and they're going to need to get a job at a DSO. Yep. And so
I don't know if it's just DSO, Howard. It could be any practice, solo practitioners.
But who's been hiring almost all of them for the last decade? And I'm going to admit something. I always admit my failures. I know people look at me and say, he's got to be flawless. But no, I'm actually a human. One time, I remember it was a long time ago, I think I said something where I was even wrong. See, I can't even say wrong because I'm never wrong. But my gosh, when I hired kids that just graduated, oh my God, they come out the first year and you thought you were being nice and you sent them to go learn implants and endo and all that stuff, and they come and they do this stuff, and then a year or two later they leave and go on, and then their root canals fail and they got to be retreated by endodontists. The implant fails. And so all the people that know their numbers, they don't want a dental school graduates to do anything other than cleanings, fillings, crowns, simple routine endo. But those kids have these fantasies. I'm going to come out of school and I want to start taking classes by famous guys like Scott Gantz and Isaac David Taywall and all this stuff like that. So no one really wants these young kids except for routine basic dentistry. The DSOs, like Heartland, man, they'll hire you and send you to every implant course known to man. So they've been, the old guys like me don't want a kid out of school with no experience, and the DSOs have been taking them. But
then they leave. There's a cycle there.
The turnover is crazy
because it's a one. So to me, what's going to limit their expansion, besides the financial pressure now, the patient load dramatically dropping and will continue to be at a much lower rate, all the economic factors that are going to affect all of dentistry, the new dentist that goes to work somewhere, in most cases, still want that $700,000 sole proprietor, 30-hour a week. It's a nice lifestyle. If you're in Keokuk, Iowa, you're a pillar of the community. You're really giving back. It's a beautiful lifestyle. So, and I think many dentists want that and will want that after they get past the point of, okay, how do I handle the debt? The numbers are going to be, if I got $400,000 in debt and I have to live, how do I do it all? I don't know if there's working for a DSO. I don't know if that's possible even. So.
Well, how have you heard from any do you think any major DSOs are in trouble? Like a big brand name?
I don't know, and I don't think anybody knows anything yet because everyone's trying to figure out what to do today, and what are we going to do right now? It's triage. Oh. And, we're going to start thinking about what we're going to do tomorrow. Like, we've been meeting my senior team. What are we going to do in 9 months, 6 months, 12 months, whatever that time is? What is our customer, what is our user going to want? They're going to want help. They're going to want financial help. They're going to want lower, I think, again, if you were buying an implant for $400 and you could buy them for $100 now, you're probably going to buy it for $100 more likely than when you were going to buy it for $400. If you were referring out the surgical part of an implant and just doing the restorative, maybe you're going to think about keeping the easier surgical ones in your practice because you got to make up income somewhere. So there's a lot of dynamics that we have to go through. Maybe there's not going to be jobs for those new dentists, even at DSOs. Maybe they will go to public health and the armed forces. Maybe that will be a good thing to build a bigger core of public health dentists nationwide for the next 5 years. Maybe that's something we're going to need. Maybe you should talk to your dental congressman there about that. So.
Yeah, these are strange times. Usually. So my final question, in your experience, do you think 9/11 event? I mean, this is really our equivalent to World War II, waking up to Pearl Harbor. Do you think this is going to bring the whole world closer together or the whole dental profession closer together, or do you think it's going to actually make it more tribal? There's a lot of business leaders in dentistry who I've talked to that are starting to wonder, why was I having so much of my stuff made in all these other countries? I want more control of my supply chain. So do you think this is going to be a negative force against globalization, or do you think we're all going to come together and just work through this?
I think it's going to be a combination of the two things. In the past, 9/11, we had a downturn in the U.S. market, but Germany was still strong, Japan was still strong. This is global. There's no market in the world that dentistry is normal today. One of the biggest markets in the Middle East is Iran. Iran has one of the highest incidents of the virus in the world, right? So nowhere you could go, no company's escaping this. Obviously, the supply chain, it sounds good. Yeah, I need domestic manufacturing. But I can tell you, I used to make a box of masks years ago for $3. But in China, I could buy them for 90 cents. So I have shareholders. Do I move everything to China and have a concern? No, there's probably some kind of migration, okay, or where you could combine both and you could have backup sources. You could have more reserves. It's definitely brought, but again, how often are things like this going to happen? I'm here talking to you to say the profession and industry must sit down now and start talking about how to help each other and not be tribal. I can't look at it like I'm going to do what's best for my company. I want to do what's best for us. I want to work with the associate to say, you know what, we will donate X amount of our profits or our products back to people that need it to get out of their holes, to help the underprivileged. I need the association. Okay, you can come to my show for free, and we'll give you more customers. And we'll promote you and your products to get used at the Bright Away Clinic in Phoenix. That's supplying $5-6 million a year in free dental care. We have to find ways to help each other and not just say, one of my biggest concerns, like you're a publisher. Publishers say, I have X amount of subscribers or distribution, right? I send my magazine to 100,000 dentists, and I'm going to charge you X amount of dollars to advertise on that page. The dental trade shows, all the meetings that are held every year, over the last 30 years, attendance has decreased. The days of the shows have decreased because attendance is bad. Costs have gone up, and it's like buying it's buying an ad in a magazine that used to have 100,000 subscribers and now has 10,000, but I'm paying more than when they had 100,000. So there's got to be like a kind of a reckoning on, if you don't want to lose it all, let's work together to, if we have 120 dental meetings a year, and I'm just using meetings as an easy example, and every state has a meeting, maybe we take 5, 6, 8 states and combine it all and move it around within that region, right?
And we knew that. I mean, I've been here in Arizona. I mean, I remember when the Arizona State Dental Association decided they were going to have a meeting, a Western regional meeting. Every single person I talked to said, really? We need another dental meeting? I mean, look at Europe. They have
No, you got to get rid of it. Look, yeah. I used to go, 1 year was in Phoenix, 1 year it was in Tucson, 1 year was in down south by Nogales or something, but they used to move the meetings around. They said, no, for the best income, we'll stay in Phoenix, we'll stay in Anaheim. Or we don't have meetings. I mean, maybe it's something else. We have public health events where if you want to come and contribute, you can provide services, and we can we have to rethink the whole thing, because the members aren't coming. And if you look today, go to any show, and there's significantly less exhibitors with less space. So it's happening slowly, and that's just one example. And I'm not smart enough to have like a 10-point proclamation for how to fix everything. But I think there's, between the professional associations, the trade associations, public health, and our government, I think we could have find ways to execute good strategies to help all.
Well, as far as continuing education, I mean, if you online CE, I mean, we started ours in 2004. I mean, my God, that was 16 years ago. We've had over a million downloads since 2004.
Yeah.
So I get that. But what about dental labs?
I mean, they're just another stakeholder in this. They're much smaller businesses generally, outside of the Jim Glidewell labs. I mean, there's 24 labs that are significant in size, or maybe 100. But once you get past that, there's 8,000 1-2-man labs in America that rely on 15, 20 offices. It's really a cottage industry. Labs, the dynamics for the dental office, the dental manufacturer, the dental distributor, the dental lab, all the same. When revenue goes down, we all get hurt. When revenue goes down this dramatically, this fast, we're all devastated.
So
how do we help each other come back?
So regarding your two favorite implantologists, Isaac Towell and Scott Gantz, when will the advanced implant educators When will they be doing courses again? I mean, is it just canceled until who
We
knows?
we we've canceled everything through July. We had we have we probably last year did over 300 dentists live surgical courses that were 4-day courses, 1 day didactic, 3 days placing implants with one-on-one supervision.
300 courses or 300
The
dentists?
300 dentists.
Okay, 300
Yeah.
dentists. Okay.
We max out at 12 to 16 per course. We were actually this year we did many courses in Tijuana. We were moving everything to Phoenix. And because we've expanded our footprint there, and we thought we would get a lot better attendance. People were kind of funny about going to Tijuana, although we've never had problems, and it was great. And we had great feedback. It was just wonderful, and we were expanding that program. Now we've had to cancel everything. And one of the great things about the program, we're helping dentists expand their services to their patients, and at the same time, we were providing dental care to people that couldn't afford it. So it was really a win-win. We were doing good by doing well, and it was very exciting. And we were expanding that. We were going to do more on a regional basis, on a statewide basis, more one-on-one in an office. Or you tell me when dentists are going to want to travel again.
Yeah.
And I'll tell you, and I'll tell you when we'll start up.
So, Isaac, his middle name is his dad's name, David, Isaac David Towell. David graduated from dental school in I think 1980. So he's been through this. Have you talked to David? How's his practice?
I haven't. I mean, David, look, I talked to Isaac and David. They have a thriving practice in Brooklyn, New York. But like everything else, it's, patients stop coming. What do you do? Everyone's trying to figure it out right now, Howard. And a more established practice with less debt, they can hang around a little longer or keep their staff on a little longer. But for how long? I mean, there's too many unknowns here. We know we're going to need help. I know from my own company, to get working capital from the SBA will be invaluable by maintaining employees and keeping us going and as we get back to full work.
Okay, well, I've already stole too much of your time. I'm sure you need to get back to social isolation.
Right.
Carey, stay safe. Man, you've been an idol.
I'm very fortunate. I have a balcony in my apartment in Manhattan, so I can look out at a city that's usually teeming and noisy, and I really feel like I'm living in the middle of a movie. So it's kind of great. I'm very fortunate that my wife is putting up with me, and in our social isolation. And I've been in touch with my whole team. We're emailing, we're thinking, what are we going to do? How are we going to do? What are we going to offer our customers? What kind of help are they going to need? So I could part with, we will do everything we can to help our existing customers and new customers. And anything that doesn't put us out of business. When they come back, we'll be there for them. We'll work with them. For if it's credit terms or free products or people that can't afford it, if they're going to do the procedure, we'll help them with free implants, whatever it takes. I hope I'm part of a bigger committee and group, maybe through the Dental Trade Alliance or our association, that could have something more official. But we'll do everything we can to help our employees, our stakeholders, our dental labs, our dental offices, and the profession. And Howard, thanks for communicating this. And please get Jack Dillenberg, probably the most astute public health dentist I know and have ever known, and his friends. He's connected to every good public health dentist in the country that knows all the insurance companies that can react to this. Get those 4 congressmen that are dentists to talk about what they're going to recommend to help the dental profession going forward.
Okay, well, Carey,
Please.
thanks for being a leader in our profession for so long. And I just want to add to that list, my most number one concern is the 6,500 babies graduating a May away. When you're a human, you're born at 0, but dentists are born at 25 and they retire at 65. Right. And so these babies are coming online right now, and they're all scared. I think it's going to be great for them because they're gonna be a lot more skeptical to financial leverage and all that stuff. But I think we're all going to come together, and I think we're gonna. This too shall pass, and we'll all be stronger because of it. Thank you so much for coming on the show.
Let's lead it that way.
Okay,
and,
have a great.
Bye-bye, Howard.
Bye-bye.